Hello, Dr. Lynn here. Today I would like to talk about a hormone called leptin. Now, leptin is a powerful hormone that is released by your fat cells. Leptin regulates your body weight by telling you when to stop eating. In other words, it tells you that you are full. Okay? So leptin is one of the most powerful metabolic regulators that tells your brain that you are full and to stop eating. This is the way fat storage speaks to your brain. Now, in a perfect world, you would start your meal and you would become full or not hungry anymore after consuming the needed nutrients and be done with it. But there's a problem. Many people have what's called leptin resistance. What does that mean? Well, normally the fat cells, again, they release that leptin, it gets into the bloodstream, travels up to the hypothalamus and signals the brain that you should stop eating because you have consumed enough nutrients. But the receptors in the brain don't respond and never receive that message. So guess what? You keep eating. What happens then? Well, you start packing on the pounds. You gain all kinds of weight. You start overeating. You don't understand. One of the causes of leptin resistance is an inflamed body. When your body is systemically inflamed for any length of time, your body starts to release chemicals called cytokines. These cytokine chemicals can block the receptors in the brain, and the signal just can't get to the hunger center to tell you to stop. Now, until you address the leptin problems, you're not going to lose weight, or you're going to have a very difficult time losing weight, and you're going to continue overeating. So how do you find out if you have a leptin resistance problem or an inflammatory problem? Well, we do all the blood tests, but we don't stop there. We also run those inflammatory markers, that is the cause of the leptin resistance that's associated with this. So high leptin levels are also associated with this weight gain, the inability to lose weight, overeating, infertility, tends for heart disease and cancer, accelerated aging, and type 2 diabetes. So if you're struggling with weight loss programs, overeat, when you know you have had enough, you might be leptin resistant. Call us and we can get the blood test ordered and get you on the right weight loss program. Thank you for listening. I hope you enjoyed this short video.